Hi, this is Dr. Daniels, and you're listening to Jammin' with Jen. And this is the Sunday, March 20th, 2022 edition. And today's topic is handling setbacks. Yep, we all have them. And today I'm going to share with you one of my setbacks and how I handle it, hoping to inspire you. And as always, think happens. But first, but first, Mom is really doing great. She is 90, and she fully expects to reach 91, and quite frankly, she's doing so well, there's no reason to expect she wouldn't. And she's just taking each day one day at a time, which is excellent. Before, she felt that the end was near, and so she had to get this done, get that done. And she was very kind of stressed and uptight. But now that she's realized, one day at a time, it might be a month, might be a year, might be 10 years. So it's really nice. It's just so much nicer and easier to talk with her, chat with her, and enjoy her company. So that's really nice. That's Mom. Then there's a Home Healers course. You'll hear more about this in today's show. But the Home Healers course is just a phenomenal collection of recipes, instructions to help you handle any emergency that might arise at your house quickly in less time than what it would take for an ambulance to arrive. Literally is your ticket to health and independence in the privacy of your own home. So please go to vitalitycycles.com and check this out, Home Healers course. We're having a promotion until April 1st. If you sign up for the course between now and April 1st, 2022, then you'll receive, bam, 2 bonuses. Well, 2.5. The first bonus is a question and answer session. You can send in any questions you have and be live on the call to ask your questions. I will be live answering all the questions, and as always, I will stay until every last question is answered. The actual Home Healers webinar question answer session will be a couple of weeks after the April 1st deadline to give you time to go through the course and to get together any questions that may arise as a result of looking it over. The next bonus is of the people who purchase the course and sign up, I will pick one to do a case study. And if you're selected, we'll let you know, and we'll also send you additional questions I might have that will help me do a better, more in-depth examination of your situation. Okay, so Home Healers course, those are the bonuses. Deadline, March 31st, yep, which would be April 1st. And look forward to seeing you on the webinar. Next, our sponsor, yay, our sponsor, Vitality Capsules. We have regular and we have extra strength, yay! Check them out at vitalitycycles.com. This is the internal cleanser, which is comfortable enough for everyday use. I take them myself, yay! All right, and finally, turpentine. Got to take our turpentine. And the first thing we're going to use is white sugar. This is cane sugar. Those of you who don't have the guts, balls, whatever to use cane sugar, well, maybe there's something else you'd like to use. Or maybe you need more information. Go to vitalitycycles.com, get your free report, the Candida Cleaner, which tells you all about cane sugar and turpentine. So we're going to take a spoonful of sugar, which does help the medicine go down. That's the sugar. Then we've got turpentine. And you must label everything if you're going to do stuff at home yourself. Label turpentine. I use a pipette. This is billed as a 3cc pipette, but honestly, it's 2.5 cc's right up there at the neck. And that happens to be my dose, which is half a teaspoon, 2.5 cc's. And we're going to suck it up. And you can see there it is. And we're going to squirt this. And this does not soak all of the sugar. That's very important not to soak all the sugar. because sugar acts as a slow release vehicle and reduces the toxicity of the turpentine. In other words, gets rid of it. So you don't have side effects, and it's a comfortable experience. And then finally, we have some water. Yay! To get it down with. You've got to get it all the way down. So drink as much water as you have to get it down to the bottom of your sternum. That's this bone in the center of your chest. You want it to go all the way down. So I'm going to drink a little bit more. All right. So you can see we spilled some sugar here. Made a mess. We're just going to move that to the side so we can bring our keyboard back to its rightful place. Yes. All right. That brings us back to setbacks. Handling setbacks. We can also roll us into the my progress section. So we all have setbacks, and today I'm going to share with you one of my huge setbacks, how I handle it, and I hope I can inspire you. So, as you know, I've been doing splits, tumbles, and taekwondo, and managing all my household activities and adult daily activities. So what happened? Well, I decided I would do a milk fast. Why? I want to flush out my lymphatic system and replace it with new cells. So this was day 2 of my milk fast. I took my usual supplements, and on my way out the door to taekwondo class, I drank a mix of Shilajit, vitamin C, N-acetylcysteine, bitters, I make my own, and ginseng. Well, I started not feeling very well as I was walking up the hill to class. It's about a 10 to 15 minute walk, but it's uphill. Usually it's no problem. So I started class, and as usual, poured out sweat, my whole taekwondo outfit soaking wet, which is the usual. But then suddenly, 4 minutes before the end of class, I felt weak. I walked to the nearest seat, which is unheard of in taekwondo class, right? You're supposed to ask permission for this, for that, like, So I walked to the nearest seat, and things continued to worsen. I developed pain in my left groin. Even more sweat started pouring out from my skin. I developed the shakes, chills. And at about this point, in any first world country, they would have called the ambulance. However, this is not a first world country. But it felt as if one of those Star Trek transporters was dissolving all of my internal organs from the mid-chest down to the pelvic area. My heart was racing, I was shaking, I was freezing in a tropical space with no air conditioning. And I realized the end could be near. Yep. I didn't want to alarm anyone. I mean, dying is one thing, but why create a commotion? That's what I was thinking. But when my instructor asked, "Are you okay?" I said, "Nope." He asked what's wrong. I told him, and he said, "Oh, you're just having a low sugar attack." So I said, sounds good. So I handed him $1 and said, "Hey, could you give me a bottle of the most sugary drink you have? Because the Taekwondo studio sells these beverages on the side." So he came back with Gatorade. I was so ill, I could only put it in my mouth and I couldn't swallow it. I said, what are we going to do now? So my teacher said, "Well, I know you bring candy to class and hand it out to your favorite people. Do you have any candy?" I said, "Yeah, I do." He said, "Well, eat some of that." So I pulled out my cookies and cream white chocolate kisses and started sucking on one of them. And it did go down easily, and I immediately felt 10% better. That means I stopped feeling worse. So I felt I was a few steps further from the edge of death. Now it's time for me to think. So I usually walk home from class, and I quickly determined that I could not walk home from class. That was not possible, but I calculated that I could probably make it across the street. So I said, "Hey, I'm good. And as luck would have it, there was a cab stopped at the light, and he was not otherwise occupied. So I crumpled myself into the cab. I made it home. I tore open a bag of creamy wafer cookies that I keep for the grandkids, and I ate 6 of them. And with each sugary wafer cookie, they were not organic. Yes, who knows? They had the long ingredients list that we all try to avoid. But I felt better bit by bit. I went immediately to bed and ate cookies throughout the night. When I got up, I was happy, of course, to be alive. But I could only make it to the bathroom, not the kitchen. So I went back to bed, and by noon, I was able to make it to the kitchen. Yay! Victory. Now, what I knew from my background as a doctor is when your blood sugar is low, you can't just treat it and bring it up. No. You have to actually keep treating it until it goes up and stays up. In this case, I would know that it stayed up because I would continue to get stronger and stronger. So, I could not wash dishes, I couldn't prepare food, I couldn't get the laundry off the line, and it was 2 p.m. until I had the strength to go walk with the wild dogs that are not mine. A good friend took me to get some greasy smoked brisket, thank God. And the hole in my midsection was now 1/4 the size it was the day before. And I was able to walk on the beach with assistance. And I knew that what I needed was organ meat to finish repairing and fixing and replacing all these organs in the center that literally had been blown out. So I told my friend this, and we found a wonderful, outstanding international chef who just happened to be in the area, who agreed to make an organ soup. So we went down the list. Brain, he said, yep, I'll put that in. Liver, yep. Lung, yep. Heart, yep. Kidney, yep. Testicle, yep. Intestines, yep. All included. So the next morning he killed a goat and boiled up all the organs in a very tasty soup, I have to say. As I ate the soup, I could feel the hole fill in completely, and I was able to resume my stretches. And 2 days later, I resumed Taekwondo classes. And I'm happy to say I am on the mend. But wait, what happened? Like, what happened? Good question. What happened, and this is what you should do whenever you have a crash like this, is ask, well, what happened the 24 hours before? Well, I had a milk fast. It was milk, but it was a fast nonetheless. Now, milk has a little bit of sugar, not much. It has a fair amount of cholesterol and some fat. Also, I had extreme exertion, very low blood sugar, and apparently dissolving many important structures internally. I mean, literally, I could feel like an emptiness or vacancy there. So what was the solution? First of all, this can happen to anyone. We can all make mistakes. So first, foremost, what I did, and what you should do, is stop. S-T-O-P, all caps, stop. Whatever you're doing, wherever you are. And the first thing to do is drink some water as you sort things out. And as you drink the water, you should notice, is the water helping or not? In my case, the water was not helping. And review the events of the prior 24 hours, and you will notice you had a lack of something, like not enough water, not enough fat, not enough cholesterol, not enough bowel movements, not enough sugar, or not enough vegetables. So clearly, if I'm on a milk fast, I definitely clearly had a sugar deficiency and certainly no vegetables. Bowel movements were quite okay. Water was fine. Fat and cholesterol, But again, the problem was on top of these deficiencies, I threw in extreme exertion. So if you're not sure which one of these things you're missing, don't worry. Add what seems to be missing. So slowly put something in your mouth and see if your body accepts it. If not, not a problem, try something else. So in other words, I tried the Gatorade, my body said, nah. I said, okay. I tried the sugar, and I was able to suck on this chocolate thing, and my body accepted it very nicely. And then once I got 2 of the chocolate kisses down, then my body was willing to accept the Gatorade. And so what you want to do then is when you try one thing, your body says, put it aside. Then try the next thing. And your body will say, oh, okay. And then you can go back to the thing you tried previously. So in my case, the sugary drink was a yeah. The piece of chocolate candy, which was cookies and creams chocolate, was a definite yes. And then monitor yourself for improvement. Do more of what makes you feel better. So in my case, the cookies and cream made this big empty hole in my center area get smaller and smaller and smaller. So, okay, more of that. Now notice the location of the discomfort and focus on that. In my case, my whole area of internal organs was affected. So I found a chef that could supply me some internal organs. He killed the goat that morning, I had soup that evening. And then do not return to the activity that provoked the problem until you feel totally recovered. In my case, I skipped Taekwondo classes for 9 days. Now, when I resumed classes, I was able to do the full 90 minutes. I was sure to eat 2 cookies and cream kisses before class. And this feeling of emptiness did come back slightly during class for about 5 seconds. Stopped my activity, drank some water, it went away, I resumed class. So I continued to eat organs for a few more days, and I am fine. What is the moral of the story? It is okay to stop when your body says stop. Also, the next thing is you can heal yourself. I refer you to the Home Healers course at vitalitycycles.com. Now, clearly, simply avoiding an ambulance ride, to say nothing of outrageously expensive tests at a hospital, the cost of the course I would have made back many, many, many times just by being able to treat this one episode. And you'll learn how to do this even more in the Home Healers course. So, there it is. Stop what you're doing, review the prior 24 hours, check, and you can, it's going to be one of a few things, either water, fat, cholesterol, bowel movements, sugar, or vegetables. So, you can add those things or attempt to eat those things one at a time. And just put a small amount in your mouth and your body will say, blech, or it'll say, okay. And the wafer cookies, I would never have eaten those, but thank God I had grandkids. And I just happen to have this sugary thing in the house because of them. All right, this brings us to questions. We have got a lot of questions today. We cannot get to all of them, but I encourage you to get your copy of the Home Healers course so you can have your questions answered at the live webinar. So today we're going to do a few here. All right, what we got? Okay, so we have this question. Hi, Dr. Daniels. Do you have any answers for the 5G network rollout and microwave symptoms in our health? Yes, I do. So what we're talking about is irradiation here. And the answer is black squid ink. Dr. Daniels, what is that? Well, squids have black ink that they put out in the water to create a black screen and protect themselves. But this ink also has a lot of melanin in it, which is a building block for neurotransmitters, and also has dopamine in it. And these things control the ability of your body's electrical system to protect itself and to heal. So the dose is a teaspoon a day. Stir it into some warm water. You can pour it over pasta if you want to, and down the hatch. Take it with a meal, please. And what is your opinion on the 100+ athletes dropping dead suddenly? Basically, they were stressed. In this case, probably vaccination, because it's a requirement for athletic activity. And that's pretty much the size of it. And this is what you can do to combat being near a tower and for your children. So since I started taking black squid ink, I don't have any EMF sensitivities, and it doesn't matter if I'm close to a tower or not. I don't have any symptoms or problems. All right, so I'm going to throw all the teeth problems together. This particular question is, thank you for everything you do. How can you stop severe receding gums and loose teeth? I was a vegetarian and vegan for years. In the last 5 years, my gums have started receding and some teeth getting loose. A another person has actually mailed in the very answer to your question. I will just read it for you. It says, recent personal healing experience with turpentine and pig's feet. This person uses pig's feet. I would recommend that you use cow feet, although both will work, but cow feet is much stronger. Just last week, I suffered with pain in my upper right molar, which has a 12-year-old filling. I knew that if I visited a dentist, they would want to replace the filling, do x-rays, insist on a root canal. Instead, I applied my knowledge from your home healer's course. I'm telling you guys, get this. So this person saves more than the cost of course just with this one thing. And I set to work. I applied my knowledge and I set to work. I applied a piece of cotton with a dab of castor oil and 2 drops of turpentine to the gum area around the painful tooth and left it there for 10 minutes twice a day. I then ate oxtail one day and pig's feet on days 2 and 3. By the end of day 3, the pain was completely gone. Of course, I was certain to consume a gallon of reverse osmosis water, distilled will also do, each day, and had 3 bowel movements with vitality capsules. I concluded that the turpentine helped the body rid itself of the excess bacteria. That's true. My body had produced to break down any dead tooth material, and the connective tissue aided in rebuilding and replacement of the tooth and gum material, which is also true. Total cost, $12 for the oxtail and pig's feet. And this person says, Dr. Daniels, I am so grateful for you and your courage to share these remedies that make living so much more enjoyable. Now this is not what I recommend, but this is what they said. I actually look forward to a medical condition so I can apply and test the science you've taught, and it always works. So I recommend getting healthy and staying healthy and treating stuff with these $12 cures, in some cases even $2 cures, that replace $3, $5, $10, and $20,000 interventions. So go to vitalitycycles.com and get your course, the Home Healers course, and enjoy the pleasure of a live QA session where I answer all of your questions. Let me see if I have one more question here. Okay. Hi, Dr. Daniels. This person has osteomyelitis the jawbone, so obviously they need to eat the cow's feet. However, what we really want to know here is what is the problem? So I'm 68 years old, good health, no prescription medications, and no medical issues except the one below. I have been using your protocol a couple of months now for an infection in my jaw from failed root canals, resulting abscesses verified via bone biopsy. Ouch. After total dental restoration therapy. Oof, mucho money. The infection was brewing for years. Oh no. But got worse the last 2 years. Oh dear. Before I was able to have surgery last June. Oh no. And total titanium implants and fixed zirconia bridges. Alright, so that's another 10. So we've just reviewed here about $20,000, $30,000 in dental care. Nevertheless, the right jaw is infected and surgeon removed the visible infection when removing my teeth, but the pathology got further into the bone. He was only able to go so much. That's crazy. This person is suffering a lot. My main complaint is loss of energy, loss of appetite, and feeling crappy. Okay. So when I take the turpentine and sugar, I feel it working on my jaw big time most of that day. Yesterday it actually decreased the swelling in the bone for the first time, and I felt less crappy. I believe your protocol is helping better than any natural product I've taken. Oregano oil, silver, garlic, high dose C, vitamin D3, zinc, golden seal root, etc., etc. This person has put out a lot of energy. Because I'm seeing a positive effect, rather than take 2 sugar cubes twice a week, I was thinking I'd take this smaller dose 3 times per week. Some more frequent dosing. That is absolutely fine, but for God's sake, eat some cow's feet. Having this infection in my lower right jaw has been going on longer than any medical issue I've ever experienced. This is a good clue. Whenever you have a medical issue that's going on for a long time and is not improving, you have a malnutrition issue. And in this case, his malnutrition is lack of strong connective tissue, which would be cow feet, or as in the prior example, a person used pig's feet as well. Thank you for all that you do and for bringing to light this age-old remedy. You're welcome. All right, and that is all the questions that we have time for today. And as always, remember, think happens. Yes, and let it happen to you.